We partnered with two local facilities, one being a SELA home, which is a home for the developmentally disabled. I believe it's about a 10-bed facility. And then we have one long-term care facility located in our county, and it is about an 80-bed facility. Reaching out to them, working with them, helping them control program and bouncing ideas. So just kind of being support for each other throughout everything.
First of all, we collaborated internally. Health departments often work in silos, and so this project gave us an opportunity to develop a cross-cutting team internally with expertise that would be useful to the project. And we also collaborated externally. One of the partners was Health Quality Innovators, HQI, which is our technical consultant, infection prevention control consultant. And they were invaluable in terms of helping us to design our training plan. Another partner that's been critical is collaborating with Network 5, which is our end-stage renal disease network technical assistance provider. Network 5 was really critical in terms of providing us information to help us prioritize dialysis facilities based upon bloodstream infection data.
We are an incredibly tiny rural community. For our reaching out, I think it's a lot different than in these large metropolises. We pick up the phone and say, hey, it's Jamie, how you doing?
I was really selective in building a team that had the capacity, or at least had worked in some aspect in the area. We had a very clear plan moving forward and really assessing what were areas where we needed more additional capacity and information insight. We had an introductory meeting, explained what we were doing. They were enthusiastic. Once we got into it and we identified the infection prevention specialist or person conducting or responsible for that at dialysis facilities.
Find somebody that would know who would be best to work with. So I just think just finding that one contact person.
Let them know we're here. You know, your health department is behind you. We're here. And I think that is so important in infection control. Besides all the best practices that you do, I think the emotional support and letting people know if you have questions, we're here, call us.
Mm-hmm.
I highly recommend developing a cross-cutting team within your own health department, looking at what the outcomes of that, and then really assessing who should be on our internal team. Another thing I would recommend is allowing margin, building margin into your project plan for delays with contracting, coordination with partners, even in implementing your plan. And so we did divide our project up into phases, and that would be another thing, break up your project into phases. We did have a project planning phase. We also did an implementation phase and a mitigation phase. We had to be very clear with what the deliverables were and the time frame. We also developed SOPs, standard operating practices for our team, and just wanted to make sure that we had a lot of moving pieces and everyone was clear on processes for connecting with the dialysis or nursing facility scheduling, follow-up. And so just really being thoughtful and looking at the full scope of your project and tying that to a timeline and having margin in that timeline.